Good morning, students. Today we will be learning about experimental epidemiological studies. These are the learning outcomes. At the end of this session, the students would be able to describe about the key concepts of experimental epidemiological studies, describe various types of experimental epidemiological studies, differentiate between community intervention trials and clinical trials. Experimental studies are otherwise known as intervention studies. In the experimental or intervention study, the investigators test the effect of an intervention or a treatment on the events taking place in the study. So there are some dependent variables. They are otherwise known as outcome variables. And there are some independent variables. Independent variables are intervention or treatment or some other program in the community. That is an independent variable. Then researchers will be studying the effect of independent variable on dependent variable. An experimental or intervention study may be controlled or non-controlled. In epidemiology, control means comparison. So, experimental or intervention study may be controlled or non-controlled. Controlled means there will be a comparison group which is not getting the experiment or intervention. Non-controlled means there is no comparison group. Okay. So, experimental trials can be controlled trials. Controlled trials means there will be a comparison group and experimental group. Or non-controlled trials. There will be an experimental group only, no controlled group or comparison group. Controlled trials can be divided into randomized controlled trials or non-randomized controlled trials. Non-randomized controlled trials are otherwise known as quasi-experimental trials. Randomized controlled trials can be again divided into blinded randomized controlled trials or non-blinded randomized controlled trial. So we will see in detail what is controlled trial, what is non-controlled trial, what are the characteristics of randomized controlled trial, what are the characteristics of non-randomized controlled trial, what is a blinded trial, what is a non-blinded trial. Controlled trials, controlled intervention studies or controlled trials will have an experimental group and a control group. As told earlier, control group means it's a comparison group. There will be two groups, experimental group and comparison group. Non-controlled trial. Non-controlled trials or non-controlled intervention studies will have an experimental group only. There will be no control group or comparison group. Controlled experimental trials. Okay. In a controlled experimental trial or controlled clinical trial, the experimental group receives the drug or treatment or intervention to be evaluated, while the control group or comparison group receives a placebo, no treatment, or the standard treatment. Non-controlled experimental trials. In a non-controlled experimental trial or non-controlled clinical trial, the experimental group receives the drug or treatment or intervention to be evaluated, while there is no control group or there is no comparison group. A controlled experimental study or a controlled clinical trial can be of different type. can be randomized controlled trial or non-randomized controlled trial. Okay, now we can see what is a randomized controlled trial and what is a non-randomized controlled trial. Non-randomized experimental trials or non-randomized controlled trials are not randomized, and they are also known as quasi-experimental trials. Now we can see what is meant by randomization. Randomization is the prospective assignment of study subjects. Prospective assignment of study subjects through a random method into an experimental group or a control group. As already told, there are two groups. Experimental group is there, control group is there. Randomization is the assignment through a random method to either experimental group or a control group. So please look at this slide. Okay, there are 10 participants, 10 people are there. They are randomly allocated into either control group or an experimental group. Okay, in this example, number 5, 8, 9, 7 and 3 are assigned to control group. Number 4, 2, 6, 1 and 10 are assigned to experimental group or investigational group. How they are assigned? Using a random allocation method. There are multiple methods like symbol randomization, stratified randomization, or block randomization are there. So using a randomization method, the participants, subjects are either assigned to an investigational group or a control group. Study participants are randomly. Why randomization is done? Randomization ensures that the participants in both groups, both experimental or control groups, are similar as far as possible with respect to all known or unknown factors that might affect the outcome. So, randomization makes sure that the participants in both experimental group and the control group are not having any differences. Now we can see the steps of a randomized controlled trial. Okay, patients are randomly allocated to either treatment group or control group. Then follow-up is done for a duration of time. Okay, then after that, the results are compared based on the outcome. Okay, which group? Treatment group, what is the outcome? Control group, what is the outcome? Then compare the results in both groups. Start with a group of subjects from a defined population. Okay, randomly allocate subjects to two groups, treatment or experiment group and control group or comparison group. Follow up the study subjects in both groups and observe outcome. Okay, after that, compare the outcomes in treatment group and control group. Direction of a randomized control trial is always forward. So, they are known as prospective studies. Another example of prospective study is prospective cohort study or longitudinal studies. Randomized control trial is also a prospective study. Non-randomized control trials. Control trials without randomization are intervention studies in which allocation to either experimental or control group is not based on randomization. also known as quasi-experimental studies. Okay, assignment of subjects may be biased, which may influence the study results. In which situation non-randomized control trial or quasi-experimental trial is done? When randomization is not practical, when randomization is not ethical, okay, when having a comparison group with a placebo is not ethical, in that case, non-randomized control trial may be practiced. Next, we will go through blinding. What is blinding? Blinding is otherwise known as masking, is the scientific procedure by which those who are involved in the research are made unaware of the allocation of individuals into experimental or control group. Those who are involved in the research are made unaware of the allocation of individuals into experimental or control groups. Blinding can be single blinding, double blinding, or triple blinding trials. In single blind trials, the study subjects or patients do not know to which group they are allocated. Patients do not know if they are getting treatment or placebo. They don't know if they are in the experimental group or control group. The term double-blind trial is used when both the investigator and the participants are unaware of the type of intervention. Both the investigator who distributes medicine and the participants who receive the medicine do not know if the participants are in experimental group or control group. That is known as double-blind trial. In triple-blind design, patients, clinicians, and statisticians. Okay, patients who are receiving treatment, clinicians or investigators who distribute treatment, or statisticians who are measuring the outcome or who are analyzing the data are unaware of which group is subjected to intervention or comparison. Okay, now we can go through another classification. Randomized controlled trials can be classified as concurrent parallel type trial or crossover type clinical trial. Now we will see what is a concurrent parallel type clinical trial and what is a crossover type clinical trial. Randomized concurrent parallel type clinical trial. The framework is as shown. Okay, the patients will be randomly assigned to either experimental group or control group. In this diagram, exposed to specific B is the experimental group. Unexposed to specific B is the control or comparison group. They are observed for a duration of time. Okay, those who are allocated to the experimental group will be in experimental group till the end of the study. Those who are allocated to the control group or comparison group will be in that group till the end of the study. Okay, then the outcome are compared. A concurrent parallel study is a type of clinical study where two treatments A and B are given so that one group receives only treatment A while another group receives only treatment B or placebo. Okay, another design is randomized crossover type clinical trial. The study subjects are randomly allocated to either treatment group or control group, and after a sufficient treatment period and a washout period, they are switched to the other treatment for the same period. So if the study period is 6 months, first 3 months, one group will be getting treatment. The other group will be getting placebo for first 3 months. Then there is a washout period to remove the effect of the drug from the body. That washout period may be 15 days or 20 days or 1 month. That period, both the groups will not get treatment. After that, those group which got treatment in the first half will get placebo in the second half. Those group which got placebo in the first half will get treatment in the second half. I will show you a diagram. Okay, the randomized crossover type clinical trial, patients will be randomly assigned to either experimental group or control group. First half of the study period, experimental group will get the experiment or treatment. First half of the study period, placebo group or comparison group will get placebo. After that, there is a washout period. The washout period is based on the time required to remove the drug from the body. After the washout period, the second half, experimental group will get the placebo and control group will get the treatment. Then at the end of the study, outcome is compared among exposed and unexposed group or experimental group and control group. Now we can go through the advantages and disadvantages of randomized crossover type clinical trial. What are the advantages? All subjects serve as their own controls. So we can remove the effect of confounding variables or other extraneous variables because same subjects get treatment and a placebo. So we can compare the outcome in both the treatment, either experimental group or control treatment. Smaller sample size needed than in concurrent parallel design. Okay, sample size required will be less in crossover type clinical trial. All subjects receive treatment at least during some period of time. At least during some period of study, all subjects receive the treatment. So it makes a crossover type clinical trial more ethical than concurrent parallel clinical trial. What are the disadvantages? Washout period may be long or unknown. Sometimes we don't know how much period of time the drug will be staying in the body and acting. Sometimes if somebody is using antibiotics for a communicable disease, patient may get cured fully. So there is no washout period and we cannot study the outcome in the second half because a patient is fully cured because of the treatment. Cannot be used for treatment with a permanent treatment effects such as antibiotics for bacterial infections or antiviral treatment for viral infections. Now we can go through community intervention trials. That is a type of experimental research design which is done in the community. Effectiveness of an intervention in the community is studied using community intervention trials. Intervention can be a treatment, a vaccination, health promotion program, health education program, behavioral modification, nutritional intervention, or lifestyle modification. Experimental epidemiological studies, okay, can be community intervention trials or clinical trials. Randomized controlled trials are mainly clinical trials. Community intervention trials can be either parallel controlled trials, self-controlled trials, or externally controlled trials. Now we can see what is a parallel controlled trial. Parallel controlled trials means intervention A is given to a group of randomly selected villages or communities. Okay, intervention B or absence of intervention A or a placebo is given to another group of randomly selected villages or community. They are known as control or comparison group. Health outcome in both groups of villages or communities are compared. Okay, if we are studying the effect of vaccination in a group of villages, one group of villages are randomly selected and a vaccination is given. Another group of villages are randomly selected and no vaccination is given. Health outcome in both group of villages. Okay, disease occurrence in those villages which got vaccination is compared with disease occurrence in those group of villages which didn't get vaccination. Health outcome in both groups of villages or communities are compared for studying the effectiveness of intervention A or for comparing intervention A with intervention B. That is parallel controlled trials. Now we can see what is a self-controlled trial. Intervention A is given to a group of randomly selected villages or communities. Health outcome before giving intervention A is compared with a health outcome after giving intervention A. It is similar to pre and post test comparison. Okay, pre and post intervention comparison. That is known as self-controlled trial. Intervention A is given to a group of randomly selected villages or communities. Health outcome before the intervention is compared with health outcome after giving intervention. Now we can see what is an example of externally controlled trial. Externally controlled trial means intervention A is given to a group of randomly selected villages or communities. Participants receiving the intervention being tested are compared with a group of individuals who are separate from the population tested in the trial. Some external population is taken as the comparison group. The participants who were receiving intervention are compared with a group of individuals who are separate from the population tested in the trial. Most common type of external control is a historical control. Maybe um, one group of village is getting an intervention. The outcome is compared with outcome in before 10 years or outcome before 20 years. It is compared with historical control. Okay, before 20 years, what was the outcome? Today, what is the outcome? Then compare. That is a historical control. Externally controlled trials can be of another type. Okay, villages in Malaysia are selected and an intervention is provided. Then the outcome is compared with a group of village in Singapore, a group of village in Indonesia, or a group of village in some other country, which is comparable. Okay, now we can go through the steps of community intervention trials. There are four main steps in a community intervention trial: selection and randomization of study and control group, baseline data collection, intervention. Then data collection, comparison, and interpretation. Now we can go through each step. Selection and randomization of study and control group. study villages and control villages. Control villages are the comparison villages, are selected randomly from a list of 10 villages. 5 villages are randomly selected as study villages or experimental villages, and 5 villages are randomly selected as control villages or comparison villages. Baseline data collection. Baseline data related to outcome from both study villages and control villages are collected. So before starting the intervention, baseline data about outcome is collected to make sure that there is no significant difference between study village and control villages. Then intervention. Intervention A is given to study villages. Study villages are otherwise known as experimental villages. Experimental group of villages. Intervention A is given or experiment is given to study villages. Intervention B or standard treatment or lack of treatment or placebo is given to comparison villages or control villages. Then comes the last step of community intervention trial: data collection, comparison, and interpretation. Data related to health outcome are collected from study and comparison villages. Health outcome from both study villages and comparison villages are compared. Okay, the uh, incidence of disease in study villages is compared with incidence of disease in comparison village or control village. Or outcome, mean hospital stay in study village is compared with comparison village. Effectiveness of the health intervention is interpreted. Thank you.